Hey everyone, it's Paolo Shao. Take a look at this pretty neat chart. I was first introduced to this chart in my first term in chiropractic school, and it's a very great visualization to really understand what exactly is the chiropractic adjustment and where the adjustment fits into the grand scheme of your body's ranges of motions. So let's start with the white area that I am now going to shade red. This is called the neutral position. It's the relaxed position of a joint or your body in a neutral position where you have normal muscle tone. Right now, you watching this video, you're in a neutral position, unless you're hanging upside down from a monkey bar watching this. Any and every movement you do in this area is what we call active range of motion. And active range of motion is just how far your joint can move on its own. You doing it by yourself, and you have full control of, for instance, moving your arm above your head. And then the opposite of this is what we call passive range of motion, which will be talked about in the next phase. As the joint goes through normal and healthy active range of motion, we reach the end of the motion, which is called the physiological barrier. As the joint is moved away from neutral position, it encroaches on this physiological barrier. The barrier is what's responsible for limiting your active range of motion. The physiological barrier are things like the muscles, the tendons, or the ligaments that can stop you from going further. A good example is one of your neck muscles, the sternocleidomastoid, that prevents you from rotating your head too much towards one side or the other side. Any movement produced in this area that is shaded red is passive range of motion. Passive range of motion is how far your joint can move while it's in a relaxed state with assistance. A good example is a partner-assisted stretching. An active range of motion is how far the joint can move on its own, move your arm over your head by yourself, and in a passive range of motion, it's how far you can move your arm over your head when a doctor moves it for you. The reason why passive range of motion is very important is because it's used to help override the physiological barrier and can help produce more motion than if you actively do it yourself. Let's pause and talk about what exactly is mobilization as opposed to manipulation. In mobilization, the doctor slowly moves the joint within its normal ranges of motion, as opposed to manipulation, which involves a very short and sharp movement to help push the joint beyond its normal ranges of motion. Before we get to manipulation, which occurs in the next phase of ranges of motion, we hit another barrier. This barrier is called the elastic barrier of resistance. The elastic barrier of resistance is the upper limits of passive range of motion. A chiropractor would feel or palpate the joint motion and determine if it is lacking motion. Joint play is what we call the few degrees of motion that occur without engaging the soft tissue that resists movement. So usually a healthy joint will give a little bit, whereas a joint that is lacking motion will not have much motion at the end of the joint play. An easy analogy to understand what joint play is towards the end of the joint's motion, does it feel like you've hit a brick of cheese or a block of wood? And this will help the chiropractor determine what areas are lacking motion to deliver the adjustment. And then we enter the next stage of ranges of motion, probably the most important stage among chiropractors, and this is the paraphysiological space. This is the area just beyond the elastic barrier of resistance, and during this phase you may hear an audible or palpable release that we call cavitation. This phase is where the chiropractic adjustment occurs. A chiropractic adjustment is also known as a manipulation. However, you may not always hear an audible pop or cavitation, especially if the adjustment is considered a low force adjustment. A term frequently used to describe the chiropractic adjustment is high velocity, low amplitude, or HVLA. High velocity meaning it's very fast adjustment, low amplitude meaning it's a very short distance in a very short brief moment where the joint is taken through the anatomical range of motion and engages a restrictive barrier that helps elicit a pop or a cavitation of the joint. The high velocity, low amplitude spinal adjustment is considered one of the cornerstones of chiropractic care. The three most popular types of HVLA techniques are Gonstead technique, diversified technique, and Thompson drop technique. Remember, the goal of the chiropractic adjustment is to deliver motion into a joint that's lacking it and to ultimately restore full range of motion, therefore decreasing the pain. Aside from the HVLA, there are other types of adjustments. Not everyone is a good candidate for HVLA adjustments, such as patients with osteoporosis or bone density, patients who are obese or pregnant, or maybe just patient preference. Other techniques that are not HVLA include activator, coxflexion distraction, toggle recoil, and sacro-occipital technique. So keep in mind that a manipulation is an adjustment that involves a short or sharp movement that pushes the joint beyond its normal range of motion, as opposed to a mobilization where the joint is moved within its normal range of motion. Everything shaded purple is where the manipulation or adjustment occurs in this paraphysiological space. Towards the end of the paraphysiological space, we start to encroach on the limit of anatomical integrity. And this is an area that is considered dangerous to have the body's range of motion go through. This area I've shaded in black is also known as the anatomical limit. Any breach of this area can result in injury to your body, such as a sprain strain, or a joint dislocation, or perhaps even a fracture. How do you prevent yourself from reaching your body's anatomical limit? Well, first step is to don't self-adjust or crack your own neck or spine. Leave it to a trained professional. This is why doctors of chiropractic are trained healthcare professionals that go through 4 years of postgraduate schooling and are licensed and proficient in performing these adjustments. This is the art of chiropractic, learning where the elastic barrier is and going just beyond it into the paraphysiological space to deliver the adjustment or the manipulation. And once you've surpassed or breached your body's limit of anatomical integrity, the joint becomes hypermobile, which is a contraindication of adjustment. So just to review, this is the different chart that explains the similar concepts of ranges of motion. At the very far left of the chart, we have N or neutral position, your body or joint in a relaxed position. Every motion that is produced within this area is called active ranges of motion until we reach the physiological barrier. Every motion that's produced after is called the passive range of motion, up until the elastic barrier of resistance. And past the elastic barrier of resistance, then we enter the next stage of ranges of motion, the PS, which stands for Paulo-Shao. It also stands for paraphysiological space. This space is really crucial to the chiropractic adjustment because it is where the manipulation or the adjustment occurs. The paraphysiological space is where you may hear an audible cavitation or pop during the adjustment. Beyond the paraphysiological space, we start to encroach on AL, or your anatomical limit. Any breach to the anatomical limit may result in injury, which is why it's very important that your chiropractor is a trained and qualified professional to help deliver the adjustment within this paraphysiological space without entering the anatomical limit of integrity. In this video, we talked about the ranges of motion and where the chiropractic adjustment lives within the types of ranges of motion. We compared active versus passive range of motion, and we also compared the difference between a manipulation or adjustment versus a mobilization. We also talked about different types of HVLA, high velocity, low amplitude adjustments versus other types of more gentle, low force adjustments. Thanks for watching. I hope you enjoyed this video. As always, all feedback is encouraged and appreciated. Thanks.